Okay, thanks. Mediconecta is, we are providers of telehealth services in Latin America. So we offer online on-demand care that you can do from your smartphone, computer, kiosk, very much like an MD Live, but focused on the Spanish-speaking world. So we are present in several countries in Latin America, have a little upwards of 2 million lives that we cover. Very focused on payers and employers, so mostly a B2B and a lot of primary care, a few other things as well, but mostly primary care. And just to give you an overview of what the Latin American telehealth market looks like, it's about 600 million people. And if you kind of do the math of how many visits and what kind of money that represents, it's about a 32 billion market opportunity. It's nowhere there yet, as adoption obviously is lagging behind that of the United States and other places in the world. But I think the structural reasons why telehealth will be transformative in Latin America are even stronger than they are here in the United States, basically because there are so many people that don't have easy access or altogether access to healthcare. We're talking about between 80, 70, and 90% of people, depending on the country, accessing care through the government and not private insurance or employer-provided insurance. So that's typically not the best quality and the best access, and governments are very eager to get it onto providing telehealth and being able to offer solutions to so many people that need them. So I think the growth there is going to be dramatic, and the fundamentals are there. Penetration of connectivity is huge, so it's going to be growing a lot over the next decade. Now, telehealth utilization, as we've heard, is still pretty low, and we all know how wonderful it is, but roughly 7 to 10% in large insured employee groups. So that's really nothing if you compare it to about 3.8 yearly visits that people make to the doctor. These are numbers that are specific to Latin America in general, but I think they probably travel well, and that's kind of 380%, if you compare it to 10%, is like a huge difference. Now, we all know that there's so much that can be done with telehealth, so the figure is somewhere around 70, 75%. So a reasonable long-term target should be about 285% utilization in a year. That's about 35 times what we're seeing today. So, there's still a long way to go. We at Mediconecta have utilizations ranging in the 12 to 25% a year. So that's significantly better than what's happening in other places. And there might be a bunch of reasons for that, but my idea today is to share some of the things that we've learned over time in this 8 years that we've been doing it, and some nuts that we've been able to crack, and hopefully that's going to be helpful and interesting to you. So first, quickly on the barriers to adoption. The biggest, or the main one, is systemic, and it has to do with how the system is set up, right? So reimbursement and networks that you can use and all those things play a huge role. I'm not going to focus on that. There's a lot of lobbying that needs to happen, and that's all very important. But I'm going to talk about really the other three on the page, which are awareness and top of mind, which is really a big one. We already heard on Greg's talk. I don't know if he's still around, but it was really interesting to hear how many people don't really yet know about telehealth. There's still this new element that many people just hear about it and say, oh, wow, that's cool. I didn't know that was possible. So that's still out there. And then healthcare is an undesired need for most people, or for all of us. It's something that you really need, but you don't really want it unless you have to. So if you hear about it when you don't need it, it's like, okay. It's not like an iPhone or something that you're dying to get as soon as it comes out, right? So you have to deal with that, because people, they're just not that interested in hearing about it when they're not feeling bad. We all act like that. Then there's the behavioral stuff. Habit is just so strong in all of us. We are used to doing things in a certain way, and we'll keep doing them that same way unless big nudges make us do things differently. There's the trust and distrust aspect of having this fundamentally new way of going to a doctor, and that needs to be worked on. And then there are preconceptions. Nobody knows about it, but then when you tell them, they all of a sudden have all these ideas about what can be done, what can't be done. They're usually all wrong. So they assume that, well, this doesn't work for this kind of thing, and that's wrong. And so you have to also replace those ideas from people's heads. And lastly, execution, which we all heard many times, devil's in the details, and there are so many details on this. So let me get into the content. Hopefully in the next 5 minutes I can cover the whole thing. So first thing is awareness. You have to really cut through and shine. And I say it like that because you have to stand out. And many times that means you have to own the communications agenda. When you're talking to patients, it has to be on your terms. Usually you're going to be working through, in my world and in what most telehealth is doing here in the US, you're going to be going through an insurance or an employer, and that means cutting the middleman out. And yes, that's your customer usually. It's the insurance company or the employer who you need to tell, you know what, marketing team of my client, I need to do this in a certain way that's probably different from what you would want to do and from the normal train of communications that you have with your users. And you have to make that happen. Otherwise, it just doesn't work. And a year later, they come back and tell you utilization wasn't good. We don't want to continue this. And you have to make sure that that doesn't happen. So you have to dissociate yourself from old ways of communicating and kind of create your own. The other thing is you can't time it right. So you have to time it well. Because when people feel bad, there's no way for you to know that in that instant, you need a telehealth visit and to convince them in the short time that you have since they started not feeling well until they get care, that this is the way for them to do it. So you have to build up to it. And there are many ways to do it, but you have to have a calendar that communicates this in a relevant way so that you create top of mind, and when the time comes, they're going to think of you as an alternative. You have to force the first use case. We do a lot of things to do that, but you have to become creative and make it preventive and make it, create risk assessments and things of that nature that are not really patient-initiated, so to speak, but that will expose them to that experience firsthand. And then when the time comes for them to use it, they will be able to remember you and actually look for you. You have to involve the family. This is something that works really well. And I have this concept of the head of household, which is you have to identify who that is. In our case, it's usually mom, and you have to speak to them directly, even if they're not the account holders for that service that you're providing. And then other influencers like coworkers, kids that are mobile first and that would want to engage in a certain type of experience, you have to also target them and kind of make sure that they communicate for you. You have to say it right from the subject on. Subjects in emails are like the most important thing. You can't, you have to do it well. You have to seek familiarity. You have to avoid things that sound like cheap or like promotional hooks that people will want to run away from. And you have to speak about utility in very concrete words that people will see relevance in. Now, behavioral stuff, you have to take down the walls. So the content that you produce in order to get people to understand what this is and actually get convinced that this is for them and that they can use it has to be relevant. It has to be well targeted to whoever it is that you're speaking to. It has to be fresh. We usually talk about prevention. We talk about what to do if you face a certain situation. Those things are interesting. It has to be your own. You can't recycle stuff that you find laying around. And you have to involve your medical professionals in creating this content. You have creative teams that are good, but they're not, it has to be medical grade or whatever that service you're providing is, they have to be involved. And that costs a little more, but you have to do it. And yes, you have to state the obvious over and over. So don't think that people that are going to be using you as a service think like you. You've been doing this for so many years. Many things are so obvious for you, but even the fact that this is a video conference for most people is like, oh, wow, it's a video conference. You don't even think you need to say that, but yes, you do. And you have to find a way to think the way the patient that's never heard of this is going to be thinking. So you have to be very careful with that. And then building trust. Use your doctors, showcase them, make them create content, make them talk about what things can be done and can't be done using telehealth. Make sure that you leverage positive brand associations. If you're working with a big insurance company, I said before, make sure that you communicate independently from the way they do it, but also people have a tendency to trust big brands, and so use that as leverage. And then execution is so important. So one thing is, you have to nail it. So one thing that we've done, and it works wonders, is to be there in person. And that makes it very tangible. We have kiosks, we have activities where we activate in employer sites and so on. And the utilization that we get from those things is like 4x what you'd get if you didn't do things in person. So as much as I'm doing something to remove the physical and in-person constraints, I still think we need to do a lot of that in order for people to see this as something tangible and kind of do that inception of what this can do for you. And the ROI is huge. So yes, it costs money to be there in person, but the ROI is huge because if you take 4x utilization and then the spillover effect of someone who's done a visit in a kiosk and then goes home and downloads your app, that has huge impact. The channels are so important as well. We heard it before, but my point here is make sure that you segment your audience. You do like a multi-channel strategy, and you talk to them on social media, on email, on print, whatever the right medium is for that audience. You have to use it, and you have to have those channel-specific capabilities, which sometimes you don't have. You have to build them. And then last, and my favorite one, I'm a bit obsessive about this one, is you have to nail the patient experience, and this is like huge. I call this the visit chain. So there's a chain of events that need to take place one after the other for a successful visit to happen. And the longer it is, the more places that you'll lose people in the process. And someone you lost trying to have an e-visit is like, you want to shoot yourself. Like, you don't do that. So make sure that you shorten that chain as much as you can, or at least take some things out of it and postpone them. If you want to get information on their allergies, conditions, maybe do it on the second visit. But don't introduce things that you think embellish and enrich the process if they're not strictly necessary. They're just more points where people can trip and you lose them, and then the whole thing doesn't happen. And look at those strong and weak links. Make sure that you keep the strong links and take the weak ones out if you can. If you can't take them out, make them work. So these are technical things like if there are firewalls, if there are single sign-on processes going on. These are things that will trip your users into not achieving the end game, which is having that first visit. We already heard that telehealth in general has net promoter scores like that are through the roof. So in our experience, it's like 93% of people love it. And once they've done it, they will come back. But we need to expose people to actually being able to learn about this, have that first visit, and then becoming repeat users. And I think that's going to help a lot in terms of getting everyone to use telehealth in a dramatic way. Thank you so much.
So I have time for one question.
Any use cases of people or your members working in the U.S. and connecting with their providers? Not in the U.S.?
Well, we don't have U.S. providers in our network, so everything we do is local in the sense that a Mexican patient sees a Mexican doctor, a Chilean patient sees a Chilean doctor, and so on. The reason for that is both legal, because we have to be able to prescribe, and also cultural, even between countries where you could have some kind of arrangement to prescribe. People want to talk to a doctor that sounds from their same place of origin. So. No, not now. We've done it, but it's not representative of really what we do. We're very focused on Latin American patients and physicians for the most part.
Do you have regulatory licensure guideline components across Latin America?
Yes.
For the physicians?
Yes. So it in general, it varies across the board. Every country is a little different. But the main thing you have to have is the doctors have to be certified locally, so each country will do that. Brazil is the only where, like in the US, you have state-by-state certifications for physicians, but Brazil is still illegal. Telehealth, for the most part, is still illegal in Brazil. That's changing soon, or it already changed and then went back, and it's going to change again. So yeah, so each doctor gets licensed in their country of origin, and that they can practice in that location.
How about one last question?
What about like American educated groups and English-speaking populations down there?
You mean English-speaking populations in South America? What's that? Yeah. Right, so in our world, as long as they are within some kind of local insurance or employer, they can get access to our services. And obviously, if they're living there, they would want to have access to a local physician if they want to buy a prescription or get a diagnosis locally. So we don't discriminate in the sense of, like, it doesn't matter where you're from, as long as you are in our clients' subscriber base, you get access. I would assume, I don't have numbers for you, but I would assume that a number of the people that see our doctors are working for international companies, including many U.S. companies.
Great. Thank you so much for the great
Thank you,
talk.
Milton.